Kudele waziyo ukuthi ivelaphi lento yokuthi abantu babe namahloni uma bephethwe yizifo noma izimo ezithile, and exactly why and how there are medical conditions that are associated with stigma and discrimination. Good morning and a very warm welcome to Bonitas House Call here on SABC2. Bana bamankhaluseng emthwana. Bantu abakaphala. Mabandla kamjokana kandaba. Ngithi kunina nonke ebukhosini. I'm Dr Victor Ramathesele. Dinane ngulukusitsana ngaka katlu. Letla ngwana Saturday seseng hora mitsana mashomararo for the hora ya brobedu. Now today we have a jam-packed program and an equally jam-packed studio to tackle this important subject. As welcome to the studio Dr Cindy Fansale from Zuzimpilo Clinic, as well as Dr Jan Shabalala, who's a specialist psychiatrist. We also have Dr Laurie Eddy, who's a psychologist practicing in the same Sentinel area where we all are, and Antoinette McMaster, who's a suicide survivor. Ladies, and gentlemen, thank you very much for coming through this morning. We are going to be discussing a very, very important subject, which in some ways has had an impact on the level of services that we provide, the interventions that we make, and the time at which we do this. Now, don't forget to join our discussion by calling us on 0839134687 with your questions and comments on stigma. Or you can send your SMSs to Bonitas 33723. And hear this interesting discussion with somebody who has a personal experience with matters stigma. Let's watch.
He is 32 years old and has been living with HIV since he was born. He lost his mother to a TB relapse and his father to meningitis and has been supported by his sisters ever since. Dumelang, I'm Dr Ramathesele, and today we're going to be talking to Ntimwe Mpamba.
Thank you, viewers and listeners, and I'm still good and doing what I do best.
Lovely to meet you.
Thank you.
How was life for you as a child?
I mean, I was the biggest of the babies. I mean, because I'm the last of 5 kids, and I was the most pampered. I would get what I want when I want it, and it would affect the other kids because I was the spoiled child who got what he wanted. But little did I know that it was a way of protecting me.
When were you first diagnosed with HIV, and how did that make you feel?
In 2004, after I lost my mother, my family could not keep up with me because I was very expensive to maintain. So they said, go and stay with your family in South Africa where there are greener pastures. So when I got to South Africa, I was met with a very terrible cough that eroded 3/4 of my lung, my left lung. And after getting my lung healed, I lost my right eye. And after getting my eyesight back, I was forced to do an HIV test.
Okay.
But I thought it was just a normal disease that I went through because I cleaned out 88% of all known diseases to man.
Okay.
Now, when I was told the reality of it, that's when everything just got to a switch off to say, wow, I'll be on medication for the rest of my life.
How did the fact that something so serious was kept from you for so long make you feel?
I felt betrayed because all in all, you'd actually look, you actually start adding up the pieces. See, that's why I was always spoiled. I got what I wanted. I would never venture into sports. The school was just given a rule, say, don't put this guy on the track and field because he might drop dead. Swimming, I would not swim. I would just do the simple things of standard jump, that's supporting. I was a cheerleader, in short.
So when did you eventually disclose your status to your friends, and what was their reaction?
They were shocked because all in all, they thought I was a very happy guy in school who was on the most wanted list to be beaten up, but they couldn't because when they found out the person behind the most wanted list, when they see my body, they'll say, please forget about him. But they wanted to find out what was my secret to staying happy. But they thought I drank alcohol in the morning or smoked, cannabis in the morning or just did cocaine. But when I showed them the ARVs, that's when they got to understand that, so that's what he's on. And I told them, say, look, as much as you want to find out what makes me happy, it's these things. They were all shocked, and from that day, I climbed the ladder of fame in a very good way because people would actually come to me for advice, say like, how do I go get tested? What do I do? Should I trust my boy? I became a counselor, and I was actually taken under the UNICEF as a peer educator.
A very sad and heart-rending story. You got a book in your hand, Antoinette.
Yes, I actually wrote a book. I've been diagnosed with bipolar before. And I wanted to write this book to help other people understand, like bipolar sufferers, their family and their friends, what these people go through actually. It's very difficult because you think the beginning you're going mad and you don't know what's happening to you. And then once you get diagnosed, it's very, very hard for your family and your friends, and they don't understand what you're going through.
So this book helps readers or other people to understand
Yes.
and how to cope with
Yes.
mental conditions necessarily
It's my
and the
personal
stigma
story.
associated with them.
Yes, it's my personal story, and I wanted people to know, you know.
We'll come back to that.
Yes.
Dr. Eddie, how do you define stigma exactly?
Okay, so in terms of mental health, stigma is a set of negative and inaccurate attitudes that are held by the public based on ignorance and fear mostly. Things like people with mental health conditions are dangerous or impulsive. They're weak and they're to blame for their conditions. They're incompetent, they can't hold down jobs. And these can be very damaging. And an even more damaging form of stigma is self-stigma, when the person takes on those views and internalize it themselves and they live in shame and fear and they don't access support. So discrimination is the behavioral component of stigma, when people are treated differently because they have a mental health condition and denied access to opportunities and resources.
Now, if you don't know what people think about what you're suffering from, you want to suggest that you won't feel stigmatized necessarily?
Well, I think we all know, based on media and our general culture, how mental health is perceived. So everyone has their general view. I've seen it with my clients, even the young people that I see, they self-stigmatize even more because of the peer pressure. They're terrified to tell friends and family how they're feeling. They're scared of getting labeled.
Dr. Chabalala, who are the main perpetrators of stigma?
The main perpetrators are the family. The family from which...
Immediate family?
Yeah, the family
Jeez,
from which the person
the
comes.
very people you expect a lot of support from.
Yes, yes.
you kidding
The very people that are supposed to support you become the number one stigmatizers. And then it goes out to the community, to the schools, to the church, and the community at large. But it starts from the family. That's why we have a concept called high EE, high expressed emotion. That means that when you're suffering from mental illness of any sort, when you get angry, they say, it started. When you get sad, it started. You are viewed in terms of your illness, not in terms of who you are. And it starts from the family, unfortunately.
But hey, usaqadile.
Yes, that's why in the
almost it's expected, and there's a certain level of irritation
Absolutely.
exhibited at that level.
Absolutely, Victor. That's why in the treatment of any kind of mental illness, you don't leave the family out. If you leave the family out, you've left a big hole which you cannot fill.
I don't want us to fall into the trap of thinking that stigma is only associated with mental conditions, Dr. Ramthesele. But the work that you do on social media, just describe that a little bit to us.
Well, stigma is also seen with HIV. I think, ever since the HIV pandemic hit South Africa, we've seen a lot of cases of stigma. And the work that I do involves giving people information about HIV anonymously, because many people are still keeping their HIV status a secret, understandably, because as Dr. Chabalala has said, the stigma comes from family, from the community, from employers as well. You disclose your status and all of a sudden you're being treated differently. People don't want to share cups with you. So I deal a lot with that, and I give people a chance to ask me questions about HIV, anything related to HIV, on an anonymous platform.
You don't think that by allowing them to be anonymous, you're actually perpetrating the stigma itself?
Well, I'm helping them, because the problem with anonymity within the community is that when you need help, you might be afraid to go to the clinic and ask for help there. So at least people know that, Dr. Cindy, if I have a question, I can ask her a question and then take steps with the correct information.
Now, you tried to commit suicide.
Yes.
Why?
It was a whole lot of things. It just happened. You didn't have any feelings, any emotions. It was just, life was getting too much for me. And I just took tablets and I did it. But my husband saved me, so.
Now, why I'm asking you is because there'll be people, there are certain type of people, and Dr. Jan Chabalala can maybe give us shed more light on this,
Yes.
that who, once they get into a depression, they get into so what we call a psychotic state somewhat,
Yes.
and they might hear voices that are instructing them to kill themselves, or even commit many other things that are seen to be a little bit asocial in context.
Yes.
But sometimes somebody just gets into a depression where they just feel hopeless and helpless, and they think that the only way out of this is to take their lives. In your case, what actually happened?
Exactly, it was exactly that. I was very depressed for days on end. I actually got treated by my psychologist and psychiatrist, and I felt better, and then I went off my medication, and that was the wrong thing to do. 6 days after that, it hit me so badly, and you just think there's nothing left. You must just end it.
Now, the stigma that goes with it, was it because there were people who felt, you're a coward? I mean, why can't you face your issues? Or where did it come from necessarily?
Yes, it's like after that, people ignored me. Sort of, they didn't want to talk to me about it. They acted like it never ever happened. And I wanted to talk about it. You know, I wanted to get it out, but no one would ask me questions or anything. And then also from a religious point of view, you know, we're Christians. And they thought it was the devil doing this to me. It was ridiculous. I mean,
So you're told that the devil or an evil spirit was making you to try and kill yourself and stuff like that.
Yes.
Now, to what extent does religion and culture influence stigma? Because you said that it is based to a large extent on ignorance.
Definitely. There's certain cultural beliefs that get passed down from generation to generation. A big one is that mental health it's a sign of weakness and it's a character flaw, and the person is choosing to have that condition somehow. Another one is that if you speak about it, it will get worse. So there's a big culture of secrecy around mental health and shame. So people don't ever get the information they need and they don't get the help that they need.
We'll come back to this matter of shame. When it's a lodge, I'm so to a khala are pijani high sinimos, impaheliting in the elo ia in waya, kapapoko theatre, budraki bongason. We'll continue our discussion on stigma, hangangar papazo, haramatel. Some thabela le na gape ka mo ka mo lapeng taba le gone e le bana le kgethollo ya go batho ba tshwareng ke malwetse a rileng le gore tabe uwe ya go ama motho wa borena o tla no re tshwara ka motato mo nomorong ya 011 326 4740 go ba brief wa boripana bola ba SMS no thoma ka Bonitas o bore 33723 ankere wa bona. Now let's go back to our interview with Ntimbe Mpamba and hear how he dealt with stigma of being HIV positive from birth.
In your experience, what are some of the stigmas that are still attached to HIV?
Others would actually ask, the first question they ask, are you dating? And do you have a girlfriend? Do you want to have kids? You know, those questions that are indirect, but they don't understand that with or without the virus, you can still live a normal life. It's just that you've got an addition of ARVs to your life.
Yeah.
So most people think that since you're HIV positive, you've got a death sentence. But it's not supposed to be that way. It's like you're adding something, a spare tire to your life.
What support groups or organizations or initiatives are you part of that help people learn a bit more about HIV?
One of them is the Sparrow Village, where I was given the emblem, or should I say the ambassador jacket that was given to me by the owner after 23 years, because she wanted someone to carry on her vision. And I took it upon to say, look, if she wants a person to carry on what she started, I'm up for it. Because I'm one person who chases challenges and don't let challenges come to me.
Yeah.
I've got to a point where I ask myself to say, what part can I play? Because for me to be alive today, someone played a part. So it's like a carry-on chain. And there's also NAPWA and even the USAID and also World Vision.
What words of encouragement and advice would you have for other young people?
You know, I love the word ask. It's ASK. But most people think it's just a request, want, desire, or just a wanting. But when you expand the ask, it will help you understand the value of life. A is the attitude, which you create the skill. The skill will produce the knowledge. So when you accept that you've got the virus, you're going to learn the skill of the ARVs. The knowledge is you taking them at the right time and educating others.
Thank you so much for sharing your story with us today. We really appreciate it, and we hope that you continue to educate and empower others affected by this disease.
No, thank you, my dearest, and stay beautiful. I've written a book. It's the title is Crushed Yet Not Destroyed. The Secret That Saved My Life. It should be on the shelves very soon, and it will be affordable, and it's a life-changing book.
Thank you so much for sharing your journey with us and being so open, and we wish you all of the best and hope you continue to educate and empower others. Thank you so much for joining us. We really hope that you learned something today. Let's go back to the studio and hear what the experts have to say on the matter.
Experts indeed, experts indeed. Now I'm worried. I mean, Tim has also written a book. I mean, you've written a book. Do these things work? Do South Africans read these books? How many copies has yours sold?
Not many. I don't think they want to understand. It's that, you know, they feel like, what do they need to know? They, you know, there's such a stigma about it. And then when their family or friends gets diagnosed with it, they don't know how to help them, how to assist them, you know, and be part of that. And people are not interested.
It's sad because we
It
really need to
is.
get South Africans reading a little bit more. And it's not only about these kind of books where there's a personal story behind. I just think South Africans, it's only Christmas time when they're buying presents that they start looking at books. But anyway, now you attempted suicide twice.
Yes.
Now, were the circumstances the same in
Yes.
the first and the second one?
Now, the first one, I didn't know what was wrong with me. And then after the first one, I went to see the psychologist and the psychiatrist, and they diagnosed me with bipolar. Then they put me on medication. It was a long process to get the correct medication. And then the second time I went off the medication, and that was the wrong thing to do. I meant to stay on it.
You defaulted on treatment.
Yes.
Why?
I felt better. I felt great. I said there was nothing wrong with
and
me.
look, it happens to all of us. I mean,
Yes.
and it is a problem, in fact, of managing, you know, chronic disease. That, you know, as individuals, you get motivated when you feel there's something wrong with you. But as soon as you feel better, even doctors, I mean, and Dr. Shabalala can attest to that, even doctors stop treatment because the motivation is just not there. Now, having written the book, having experienced all of this, and having been a subject of stigma and discrimination, because we say stigma is what you describe, you know, feeling ashamed or feelings of shame or based on ignorance, on something that maybe is not socially acceptable, but discrimination is actually acting on it. Then that's what we call discrimination. In your case, who are the main perpetrators? Was it your family? It sounds like your husband was quite supportive. Was it?
My husband was
who
very
else exactly?
supportive. It was my family, distant family, and work colleagues. Actually, when I woke up in the ICU, the doctor that was on duty, he asked me, have you overdosed before? You know, like I was a drug addict or something. He knew nothing about me. He didn't know my circumstances. And I just said no. And I didn't want anything even to talk to him. And then he said to me, must I refer you to the psychology department? And I said no. And I just went home. I was so depressed, you know. It was like he wasn't
it wasn't a
interested.
psychiatrist or a psychologist. It was a physician who was looking after from
physician,
the
yes.
point of view of what had gone physically wrong with you after attempting to commit suicide.
Yes.
It's very sad when you guys as doctors are the actually perpetrators of stigma and discrimination. One would have thought you should know better, isn't it?
It is sad. And I mean, I see it a lot in the HIV arena as well. Because what people need when they're in such a situation, you're vulnerable. Illness is a very vulnerable time. And the last thing you need is for a health worker to judge you. You want to know what's wrong. You want to know if you're going to get better. You want to know everything about your illness or your situation. So it is sad when health workers are at the, are the ones that are, meeting out the stigma and the discrimination. And you know what? That prevents people from going to clinic. That's another thing that we're seeing, that people would sooner die than access help because they don't want to be stigmatized at facilities. And that's not what health is about.
Why is this the case? Is it because doctors are also human and doctors can also be ignorant, by the way, because they only need 50% to pass, so they only know half of what they're supposed to know. Don't you think so?
Victor, let me put you this way. There are doctors, I'm a psychiatrist. There are doctors who forget that I'm also a doctor. And who would call me the shrink or the nut doctor. Now, if other healthcare professionals like general practitioners forget that I'm also a doctor.
They forget that you know about appendicitis, you know about tonsillitis. They just think, you prescribe stuff for people who have got nuts.
In fact, there are other doctors, including administrators, they think that psychiatry department is something of a playground or a sham or something that exists in theory. And it's sad when it's like that. But then the problem is that when they have a patient who is psychotic indeed, they need us. We're like a parachute. Chances are if you need us and you don't get us, things are going to get haywire. But we have to live with that. To quote one doctor, I can't do this nonsense psychiatry department's dirty job.
Oh, no.
Yes.
But don't you think this is a problem? Because also, patients with mental conditions do get violent sometimes, and sometimes because of losing touch with reality, they might act a little bit abnormally, and that in itself is a good reason for stigma, no?
Yes, I think, and also the media sensationalizes that kind of thing. So actually the facts are that people with mental health conditions are more likely to be a victim of violence than a perpetrator. And as a group in general, they're no more likely to be violent.
Okay.
It's people that's conditions are unmanaged. They might be periodically behaving bizarrely, but it doesn't mean they're going to be violent.
Now, Antoinette, we'll be saying goodbye to you in a few minutes, but I just want to get two things quickly.
Yes.
Now, do you really think that stigma in itself has an impact at the point at which one can seek medical help for the condition that they have?
Yes, I think people are very embarrassed about it, but you know, you need medical help. You can't do it by yourself. The mania and the downs and the ups and the downs, you have to. That's very important.
Now, what message have you got for those people who might be in a similar situation as the two occasions around which you attempted to commit suicide? What message would you have for them, especially as it relates to stigma and discrimination?
You need to seek help, talk about it, and, you know, stay on your medication. You need to. And, you know, talk to people about it. Ask them to go on the internet and research it so they can see there's nothing really wrong with you. It's just an illness.
Now, you said you got a lot of support from your family.
Yes.
Now, the suggestion is that from Dr. Jandi here that the biggest perpetrators of stigma are family members themselves. What do you think is so unique about your family that they didn't actually discriminate you? And I'm talking about your immediate family, because you did allude to the fact that your distant family members were still a little bit, you know, practicing some activities around stigma on you.
I did talk to them. I explained to them what was going on with me, and, you know, I told my husband I had suicidal thoughts, and he actually forced me to go to a psychologist, and they all knew I was there and what I was doing, because I had then I was scrubbing the whole house, and then I was crying, shouting. You know, they all knew there was something wrong with me, and when the doctor diagnosed me, I sat him down and I explained.
Antoinette, thank you very much for sharing your personal experience with us. Keep on the good work. And we'll advertise the book to the extent possible. Let's get South Africans to buy the book, at least in Christmas time when they're buying presents for others. But also, please don't default from your treatment, because we want you to see you as happy, as chirpy as you are. We don't want to see you depressed again. We don't want you to see you contemplating suicide again. But thank you very much, and all the very best in your future endeavors. We'll continue our discussion on stigma when we return. Welcome back. You're watching Bonitas House Call here on SABC2. And stigma is a problem that makes it very, very difficult to manage medical conditions. And it has an impact on how patients and their families, as well as healthcare professionals and policymakers, as well as funders of medical schemes alike, it has an impact on all how these people are going to get appropriate help for the patients. And in this regard, stigma and discrimination will also deny medical intervention where it is most necessary. But let's see a little bit more about the impact on this on other aspects of healthcare.
I wouldn't say that stigma is a problem for the scheme. However, at Bonitas, we are very aware that we deal with a very sensitive medical information every day. And for that reason, we treat confidentiality as a very serious matter. It is regrettable that in this day and age, stigma is still experienced by people who suffer from diseases such as HIV, AIDS, and mental illness. However, the scheme is managed in such a way that the risk of stigma is minimized. Stigma usually takes place when there is a lack of education and knowledge. Bonitas' approach is therefore to ensure that all those who deal with our members are well trained and educated about diseases such as HIV/AIDS. Staff members are also aware that we monitor all calls and correspondence that go through our call centers, and that no stigma or discrimination will be tolerated. Bonitas ensures that the companies providing services to the scheme have strict measures in place to ensure that member confidentiality has a high priority. This includes IT and communication services, where we must be satisfied that the service provider is using the latest technology to ensure that member information and data is secure. HIV-positive members are also served by a completely separate call center manned by specialist staff who are well trained. They are therefore able to handle calls sensitively, while treating all conversations and information in the strictest confidence.
Whoa, 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 whoa. Yeah, and now we are also joined by Lerato Mokwatle, who's a media manager at Asante Stewart Foundation. Lerato, thank you very much for joining us. Now, what is this foundation, before we ask you about Stigma? What does this foundation do?
We work with disabled children, giving access to education, most importantly. But of course, as with a lot of challenges, especially disability, it's not just education. By virtue of being involved, we then offer psychological support, we give access to medical health specialists, we help crowd fund some procedures, but essentially what we do is we want to make it a very inclusive world for disabled people, starting with disabled children, so that there is no longer a generation of members of society who have just been observers to life and have just always stood at the sidelines while we get to live it as fully as possible.
Is it a view that disabled people are discriminated against?
Yes, yes, absolutely. The discrimination is very subtle. You wouldn't even notice it. It's in how we do not make it inclusive. And you go to certain places, there's a ramp, there is no ramp, and it's a multi-story building. There's only an escalator and an elevator. When both of them do not work, a disabled person is trapped, and no one wants to understand them. I've observed this kind of situation where someone says, well, if the lift is not working, get the escalator, and you're trying to explain, but I am on a wheelchair, I cannot move. There needs to be help, and it's something that's just treated as, well, make your own plan. And it carries on. It's in kids going to school.
But disabled people can also be a little bit difficult. I know as a doctor, sometimes you need emergency parking, and I once parked in a disabled area. Hey, the auntie came out, I tell you, she had a whole tirade. And I felt, sometimes it's a little bit exaggerated when people know that they have certain medical conditions and that maybe are stigmatized. Any action that you take, they misinterpret it as, discriminating against them. When in fact, that lady would not even just listen to my story. Said, you can't park there, everybody. And I said, but it's a matter that we'll discuss. Gail, you are joining us from Johannesburg. Thank you for joining Bonitas House Call. Good morning.
Good morning, Dr. Victor. How are you?
Good yourself, Gail.
Fine, thank you, Doctor.
Beautiful.
Doctor, we had an incident in the family on Thursday where my nephew is about 28 years old. He's on psychiatric treatment. And he went over to Discoverers. And when he got there, he said to the nurse that he didn't get treatment. And the nurse said, I did give you treatment. And he said, you did not give me any treatment, you only gave me some epilim. And her attitude was terrible at Discoverers. And with the result, this child walked out. And we couldn't find this child. I just phoned his mother now. We found him since Wednesday or Thursday. Came home this morning, 4 o'clock, blue, hungry. At least he's home now. But I'm very upset about the attitude. And this poor child was nearly dead. So if you could do something, Dr. Victor, about the attitude of these people at Discoverers, the mother's besides herself. We're all at home now with this child. Thank God for that.
Yeah, again, thank you very much for that. You'd have heard the National Minister of Health, Dr. Aaron Motsoaledi, announcing actually earlier this week the establishment of the Office of Health Standards of Compliance and the imminent appointment of the ombudsperson who's going to be handling that office, because we want to encourage as many South Africans as possible, if they have any issue around healthcare services that they are unhappy about, to report to these authorities, so that first we have a sense of what is wrong and what needs to be improved, but also that people who are perpetrators of such activities can actually be brought to book. And I'm sure you'll agree with that, Dr. John.
Yeah, and unfortunately, sometimes there is a question of putting people who are not well trained in a specialized field. If you put a general nurse to look after psychiatric patients, they don't have interest. You really need somebody who is trained or has interest in that particular field. Yes, granted, you just mentioned that people with disabilities can be difficult. So can psychiatric patients, But that must not be used to judge them. Correct. It could be part of the problem, part of the self-esteem problem.
Correct.
Hence, people with disabilities say nothing about us without us.
Yeah. But they've been here. That was the message. They said nothing about us without us. Yeah. And you have to agree on that.
First it's correct, but sometimes it becomes a hindrance, because when you try to help people in that space, they say, but you don't understand my space. And then they render you a little bit helpless.
Yeah, so you can't talk about this. Yeah. It's like people who are HIV positive said, look, if you are not HIV positive, and you're not wearing the T-shirt, hey, don't come and tell us you can fight our cause. Do you also find that?
It's an empathy thing. I think what Dr. Jan is trying to bring across is that it's about empathy. If you don't have the passion or you can't put yourself in someone else's shoes, there's no way you're going to render a good service.
And
I think
that is empathy is a prerequisite for being in the healthcare profession. Now, quickly, she's brought in, we've been talking about psychiatric condition, and I did anticipate that we'll get into this trap of thinking that discrimination as well as stigma is only around mental conditions. Now, she's brought in disability, that it is also an area around which we find a lot of stigma. What are some of the other medical conditions that attract stigma?
I think anything can. Diabetes.
Diabetes?
Yeah.
People talk around pride, with pride around. You know, as we were growing up, there was a Grootman who used to say, "Amoho had arthritis, Mara Clever had gout," because there are certain conditions that people are ashamed of, and there are those that people think are fashionable, like gout, because it is a disease that is associated with affluence. That it's very easy to say you've got gout because it says something about your level of income and your social status. But you are saying any medical condition can attack. Do you think ADHD among children is stigmatized?
Definitely. Often ADHD is seen as a behavioral problem, and it's thought that the parents are possibly not strict enough, and if they were just stricter, the child would behave better. But people with ADHD have self-regulation problems, and it's biologically based. And then they often get labeled as problem children, and it follows them through their school career. Yeah. People lower their expectations of them, parents and teachers, and it becomes a self-fulfilling prophecy. And they also get bullied more and isolated more.
Seriously?
Yes, definitely.
Sad. How
it's very sad.
Anonymous, you're joining us from Pretoria. Thank you for joining Bonitas House Call. Good morning.
Good morning. How are you, Doctor?
Good yourself?
I'm very well, thank you.
Lovely.
Doctor, I'm very curious. I would like to address this question to the panel. I want to find out if it's really possible for someone who's been diagnosed with either major depression or someone who has been diagnosed with some form of mental condition to, at some later stage, not be on medication. Or is it something that one would have to take for the rest of their lives?
I didn't hear the last part. Your question to the panelists, you want to know what exactly?
If it's possible, someone who's been diagnosed and currently under treatment, if at any stage of life this person may be off the treatment, would they reduce whatever dosage of medication the individual is being taking, or in the standard of what has been given would just remain like that or increase, maybe?
Okay. Brajan, quickly.
Yeah, we get this question all the time. Doctor, how long am I going to be on medication? Well, it depends on the type of condition that you're suffering from. If it's depression, pure depression without any other complications, the minimum duration of treatment is 9 months. And if it's bipolar, it's lifelong. Schizophrenia is lifelong. Panic disorders is lifelong. ADHD treatment is lifelong. So talk to your doctor. People think, and rightly so, that I'm not going to live on medication for the rest of my life. And sometimes when you tell them, listen, you're going to take this medication for the rest of your life, you can see their face is drooping right in front of you. Unfortunately, mental illness, most mental illnesses are like diabetes, hypertension. It's treatment for life or a life of battling with the illness.
Talking about that, alcoholism. Why do we have people who've got this problem not wanting to admit that they have alcoholism? Is it because of the stigma or what exactly?
I think it's the way that we view alcohol in general. I think alcohol is glamorized. If you look around, people are holding champagne glasses and everyone's drinking and having fun. But the moment you slip onto the other side of that, and now you're sinking in alcoholism, no one understands it. It's more a case of us not understanding that it's actually a problem. I mean, on Twitter yesterday, we're having a discussion around cocaine addiction and alcohol addiction. Both are very serious. But for some reason, alcoholism is not taken as seriously as being addicted to cocaine, for example. So I think it's us, the health workers, and also just the way society perceives alcohol. It's everywhere. Alcohol is easily accessible, and it's much easier to get addicted to it than it is to get addicted to cocaine. But the stigma around being addicted to alcohol, I think for people who control their alcohol intake, I don't think they'll take a person who's addicted to alcohol seriously. I think there's an element of, but it's only alcohol. But the detrimental effect it has on your life is beyond words.
Very, very interesting. Now, with children, how do you deal with stigma in a general sense? Because they are not as understanding as adults, and I have a sense that they don't have the prejudices that adults have. I may be wrong.
Yes. So the wonderful thing about children is that they're more curious than they are going to discriminate, and what they essentially want is to be explained. Mommy, why is this other person, why is this other child on a wheelchair, or why is it that they're struggling to walk, or wanting to understand why their sibling has cerebral palsy. And then they will then want to make their sibling a part of their life still. But with kids, it's very easy to explain and help them understand. The difficulty is with communities often, kids with disabilities are given labels like isdwedwe. They are not allowed to play with other children because other parents fear that it's gonna slow down their kids' development. If one child is deaf and they're spending time with your child, obviously it's going to be a very silent time. But it's just an hour of playtime. It's not 23 hours in which your hearing child is surrounded by silence, you know. So it's a very sensitive issue. On the other hand, it works with kids and families because you're able to explain. And in any case, if you have a disabled person in your family, you have to live with it. So you can't even avoid it.
But some families will hide, you know, even when there are family functions, somebody with a disability are put in the bedroom somewhere. They're not allowed to face it in the family. And I think families themselves, they perpetrate this thing, as Dr. Jan Chabalala said earlier. But we'll continue our discussion on stigma after the break. Welcome back. Ngwaneso re sa tswela pele ka hloho sa letsatsi mona Bonitas House Call ho SABC 2. And today we are talking stigma. Now, let's talk about dermatological conditions or skin conditions. There are some skin conditions that are associated with stigma, Brajan, and which are these?
Yeah, the most common one is albinism. People don't realize that albinos have a skin condition that makes them much lighter and susceptible to sunburns than other people. And people are afraid of stigma. You know, one day I was sitting with a group of young ladies, my children involved, and I said, would you date an albino boy? I said, why? You know, and you find that there is stigma around people with albinism. And the other conditions is vitiligo, where people progressively lose their melanin.
But it's all the things and all the myths that are associated with these conditions that actually create the stigma. When you talk about albinism, people say they don't die, they go and somewhere, and it's a curse and whatever. Now, albinism also, I mean, vitiligo, I mean, people think it's because you slept with whatever and whoever. All of these things are associated with that. Actually, all of these myths are perpetrators or the origins of some of the stigma in skin conditions, you suggest. Acne, any stigma associated with it?
Acne, people accept acne quite easily, you know, because it's something that they see every day and it can affect anyone. But the other funny skin conditions, people just look at them like they've been bewitched. I mean, if you look at chronic skin conditions, both psoriasis, I mean, you look like a frog's child. They call you a frog baby, you know. And I'm sure the dermatologists will talk more about it. But
that.
Having been a doctor for most of my life, I've seen, conditions that people are afraid of touching you. You know, when they touch you, they will quickly
But I think the best way to assess stigma is exactly what you did, sitting with young people and saying, would you date a person? What do they say when they say, would you date a person with bipolar disorder?
I'm sure they would say no as well. Just because of the stigma.
You did a research in this area.
Well, I've read an interesting study that was done in 2010 on South Africa's view of mental health. And they found that we've got a very low literacy for mental health. Only 30% of the respondents could identify that the person had a mental health condition. The conditions that are most stigmatized by South Africans is schizophrenia and alcohol abuse, substance abuse. And the least stigmatized is PTSD. There was more symptoms, more sympathy for that.
Post-traumatic stress disorder,
Exactly.
So because when you say we are not literate, so the ordinary South African wouldn't be able to make a diagnosis of schizophrenia.
Exactly.
An average South African, that is. Now, how would they have a stigma towards it? It's because it is called other names. I know in certain parts schizophrenia is called mafumfonyani and stuff like that.
Yes, there's so much misunderstanding around schizophrenia. People think it's a split personality, all these kind of things. But actually what it is a condition where you lose touch with reality when you become psychotic. But in between the episodes, the people function normally.
Are they violent? Maybe that's why they are called...
The media has really perpetrated that. They're no more violent than any other group.
You want to suggest that people with schizophrenia are not...
Yes.
if
Dr.
you have a lot
Jamala
of
can-
normal people who are more violent than people suffering from schizophrenia.
Well, the people that we must be most worried about are young men under the influence of alcohol.
Okay.
They're the most likely to perpetrate violence.
Let's talk about, before we take a call, let's talk about labels now. People now, they want to be called people living with HIV instead of being called AIDS sufferers. People want to be called people who are living with hypertension instead of being called hypertensives. Do you think these titles also have a way of perpetrating?
They've got very negative connotations. I think when you say to people, when you speak about an AIDS sufferer, what is an AIDS sufferer? Like, oh, lo mutu ne AIDS. No, you have HIV, and end-stage HIV is AIDS. But you can't just say, oh, this one on the AIDS. Like, we have to think about what we're saying and the way in which we say it. You know, it's the way we say things as well. I mean, I think of people living with albinism. You know, when people say stuff like, oh, she's an albino, it just sounds so.
Yeah, but it's a shower.
It just sounds so wrong.
Yeah,
So
they
that's
were
why
here a few months ago.
people with albinism, a person living with HIV, you know, we need to just think about how we're saying it, and that makes a very big
And we need
difference.
to get used to people living with this because, hey, it is rather offending to put it in any other way. Anonymous, you're joining us from Alexander, Taxi Team Zimnyam. Thank you for joining Bonitas House Call. Good morning. Anonymous. Hotel ka papa.
Teng.
Thank you, bro.
Ke le clinic ba re ke HIV positive ne. Vele mara ba ampa ke no di pilisi tsa di HIV. The ARV.
Okay.
Mara mo mpaya ka inorula gore ke alumiwa ke inorula ke tsolo. Ngale running stomach.
Okay.
Ai na kono tsibori.
Okay, but Haribu ka the ARVs today, but now that you have called, we'll attempt to answer your question. One more question. Ke dipilisi di feng tse o di sebedisang?
Hello?
O sebedisa dipilisi tse feng?
The ARV.
Tse feng ka lebitso? O na le bo Troyes monna o na le di ngata wena o sebedisa tse feng? Ah, monna o santse o di sheba monna o tlo re sitisa jwale re television phela re theoetse monna ke Moqebelo. Anyway, if it is an FDC or the fixed drug combination, which are commonly used now, would it lead to diarrhea necessarily?
Well, I think initially when you first started treatment, you'll have a wide range of side effects, diarrhea, skin rash, and so on. But in his case, he needs to go back to the clinic because we find that with HIV, there's a certain type of diarrhea which is much more difficult to sort out than ordinary diarrhea. So he needs to go back to his clinic.
And it may not be because of the ARVs that
Exactly.
Yeah, Dr. Fanseli, when I specialist here, how to into about the ARVs, or you need to go back to the clinic, despite the treatment that you are using. It may be a certain type of diarrhea which is unique to what what's wearing kirifulena lo tswere. So tsamaye clinic ka speed maro ska se ya dipilisi tsa hamra gore ba khone di checka ba bona gore iska ba ke tsona tso ba ke ran diarrhea ena ngwaneso. Kopa wetse jwalo ka pele. But anyway, thank you very much for that. We'll run up our discussion on stigma when we come back, and you need to tell us exactly how your organization is dealing with this matter after the break. You're watching Bonitas House Call here on SABC2, and welcome back. Quickly now, people with a slightly different sexual orientation, MSMs, men who have sex with men and women who have sex with other women, do they get discriminated against purely because of their sexual orientation?
Certainly they do. There's still a lot of stigma associated with people that aren't straight. So coming out is very difficult. People get ostracized by their own families, also by the church. So it's very difficult.
What about sex workers? When somebody walks into your consulting rooms, I mean, sometimes you just get a little bit intimidated. But do you think it is a stigma, a discrimination, or just a simple prejudice?
Oh, totally discriminated against, totally stigmatized. It's very difficult for a sex worker to access health services. There's always judgment and morality attached to sex work.
Okay.
And it does not exist like that. It's a job for someone.
What would be your parting messages to mothers who have children with disability on how they should deal with this matter going forward?
Do not hide your kids. Make sure that you give them a great quality of life. Make sure that you access communities and organizations like Asante Stewart Foundation so that you know that you're not alone. We have awareness days, we have walks, we have fun things that we do, and really just try to make sure that everyone, disabled people and people who are not disabled, become part of our mission. Let us make it an inclusive world so that disabled kids can grow into adults who are well-adjusted with full and thriving lives that we each want for ourselves.
Just quickly, now when I was growing up, there was a big boy in the school, big boy, and people used to to ridicule him, whatever. And after a few years, he was beating up everybody around that place. Do you think sometimes some of these stigmas and prejudices can turn people into violent behavior
Yes,
themselves?
absolutely. You become very violent, you become resentful, you become very snappy. You don't, to some extent, your emotional development becomes compromised because you are always attacked, you are always ready to defend or always to attack first.
Okay. Your key message, Dr. Eddie?
Just remember that mental health conditions are incredibly common. 30% of South Africans will experience one at some point in their lives. And people can recover, they can live normal and productive lives.
What is our way forward, Dr. Ramathesele, dealing with stigma, not only in HIV, which is an area where you have created a name for yourself, I must say, not only in South Africa, but internationally also, with a blog and whatever, Twitter and whatever that you do. So you do a lot of work in HIV and AIDS, but I'm sure you're beginning to deal with other conditions as well. And what is the future of our attempts as South Africans to deal with stigma so that we can ensure that people get the services that they need as early as they possibly need them, and they don't stay with conditions until it is too late for us to help them?
I think education is still the way to go. Knowledge, I mean, you need to arm yourself with knowledge, and that's why I continue to do what I do on Twitter and Facebook and everywhere else. And also, if you can, I think find a medical doctor who really understands what your condition is about. I mean, people are now cropping up, HIV clinicians are cropping up all over the place. Dr. Gail Ashford, Ulirato Masemula, I for one as well. I'm now in private practice
And Dr.
again.
Cindy Fansel.
And Dr. Cindy Fansel. But you need someone who understands. And I say this because my consultations will be a bit longer for a person with HIV than anyone else, because there's so much more to discuss. There's
Okay,
so
let's
many
leave it
other
at that.
issues.
Brother John, 2 sentences. Key message.
2 sentences. I think the best weapon against stigma and discrimination is knowledge. Let us arm ourselves with knowledge, because to quote an idiom in my language, a snake that you see will not harm you. So if we arm ourselves with knowledge, we can see the snake and know how to deal with it.
So to healthcare workers, to family members, to teachers, to child minders and everybody else, let us make sure that we can make people with medical conditions as comfortable as possible for them to accept what they're suffering from, and for them to discuss it, and for them to go and seek medical help. Bakithi le ndaba yokujovana naye ama-nickname anikezwa izifo, uzwa kuthiwa i-AIDS i-Z3, kuthiwa i-AIDS ethola ejele, kuthiwa i-slow poison, kuthiwa umuntu one-delirium tremens, une-shake, kufanele siyeke nayo le nto ngoba yiyo into esibuyisele emuva singakwazi ukuthi sisebenze kahle and deal with these medical conditions. Well, that's all we have time for today. Mme ho lona bohle barati ba tshehetsi ba kgothometse ka sitana le ba manokeng ba lenaneng. Sibamba ka zimbini sithi yanga nangamso. We'll be back next Saturday with hospitalisation. Oh boy, oh boy. So don't miss it here on SABC2 at 8:30 in the morning. Hlanganyela nathi futhi ngokuzayo. Arikopane ngabe ebekeng etlang. Thato highly amrena. Thanks for joining us today. From me, Dr. Victor Ramathesele. Ke mchane mchicha, ke mchana maswati, ke morama kuapana. Na menetsetla utangwa mletsani. You take care.